Today, we're going to tackle a question that I know causes a ton of anxiety for anyone with back pain, and that is this serious? We're going to pull back the curtain on how clinicians actually think about this question and hopefully replace some of that worry with some clear, evidence-based understanding.
Right. Before we jump in, a quick note. If you haven't watched the first two videos in this series explaining what low back pain is and evidence-based treatments, I'd really recommend starting there. It'll give you some great context for what we're about to cover.
Look, if you've got low back pain, there's probably one big question just looming in the back of your mind. Is this a sign of something serious? It's a totally normal fear, and honestly, it's the one that matters most to people. So today, we are going to face it head on. Okay, let's start with the single most important, most reassuring fact from all the research. In 90 to 95% of cases, low back pain has absolutely nothing to do with a serious underlying cause, like cancer, an infection, or fracture. The vast majority of the time, back pain is what we call nonspecific, which, yeah, means it's painful and super frustrating, but it is not dangerous. But I know what some of you are probably thinking. Okay, that's great, but what about my scan? What about that MRI report I got with all those scary-sounding medical terms? This is a huge source of anxiety, so let's unpack it. So maybe you've seen a report and it mentions things like a bulging disc or degeneration. And I totally get it. Those words, they sound pretty alarming, don't they? They sound like something is broken or damaged. But what does the science actually tell us about them? Okay, so check this out. This slide is, honestly, it's a game changer for understanding this stuff. Researchers did a huge review of studies where they scanned people who had absolutely no back pain, none. And look at these results. By age 50, a full 60% of these pain-free people have a disc bulge. 80% show disc degeneration. These aren't necessarily signs of a problem. In most cases, they're just signs of life. So here's the crucial takeaway. Many of these findings are just normal, age-related changes. The best analogy I've ever heard is to think of them like gray hair or wrinkles. They're just on the inside. It's an expected part of the aging process, not automatically a source of pain. And this is exactly why you'll hear that major international guidelines now strongly advise against routine imaging, because the evidence, as this quote shows, is pretty clear. Getting unnecessary scans can actually lead to worse outcomes, more worry, more tests, and even unnecessary surgeries, all by focusing on findings that are often completely irrelevant to why a person is actually in pain. Now, this brings us to the term that probably causes the most confusion and, let's be honest, the most fear: red flags. You've probably seen terrifying checklists of these online, but the way clinicians actually use this term is very different from how it's often portrayed. So here's the real definition. Red flags are simply signs and symptoms that make a clinician pause and think. They're tools that raise a bit of suspicion and prompt them to look a little deeper. They are not immediate alarm bells. They're just one part of a much larger puzzle. And this part is absolutely key. One of the highest quality reviews on the topic concluded that a suspicion of something serious should never be based on a single red flag. The evidence just doesn't support it. One symptom, all by itself, is rarely that informative. So this really requires a fundamental shift in how we look at this. We need to stop thinking of these things as individual blaring alarms and start seeing them for what they really are: potential clues in a wider investigation. This slide really lays out the difference. The myth is that any single symptom is a major warning sign. The reality is that clinicians are looking for a pattern, a combination of clues that all point in the same direction. The first approach just leads to a ton of anxiety and false alarms. The second, the real approach, leads to careful thinking, not panic. So when we say context, what do we actually mean? Well, we mean all of this. It's your whole health story, your past medical history, the specific story of how your pain started and how it's been behaving, what a clinician finds when they do a physical exam, and maybe most importantly, how things are changing over time. It's the whole picture that matters. Okay, so this brings us to the final, and I think the most empowering piece of this whole puzzle. If most back pain isn't serious, and red flags are just clues, how do you and your clinician make sure nothing gets missed without all the unnecessary worry? The answer is a really important concept called safety netting. Safety netting is all about creating a smart partnership. It's when your clinician gives you clear information about what to expect with your back pain, what specific changes to actually watch for, and a concrete plan for what to do and who to call if and only if those specific things happen. It's a plan, not a panic button. So, what does good safety netting feel like? Well, you should leave a consultation understanding three things. One, how long this is likely to last. Two, knowing exactly what specific new symptoms would be worth paying attention to. And three, having a clear, simple plan for what to do if those things occur. No guesswork needed. So, what does all of this mean for you? Well, it means your role isn't to be a detective, constantly stressed and on high alert, searching for single scary clues. It's about being able to move forward with confidence. The goal isn't to diagnose yourself using the internet. It's to have a wise, watchful partnership with your clinician, built on good communication and a clear plan. That is truly the safest and most effective way forward. And just a final reminder, this content is for general information only and does not replace an individual medical assessment.